Hi, I'm Dr. Marty Rosen with my wife, Dr. Nancy Watson, and we are honored today to have Dr. Charles Blum, one of my not only mentors, but good friend. He's a 1981 graduate of Cleveland Chiropractic College. I don't know where to start with his accolades. He is the premier researcher at SOT. He has written so many papers. He has co-written, I don't know, 6 or 7 at least papers with myself. He is on the editorial boards of various journals. He is postgraduate instructor for several colleges. He is an instructor extraordinaire, researcher. He never stops working. He never stops giving. I'm going to give the ball to Charles to let him talk a little bit about himself because I could literally go on for hours. I've known Charles since 1982, probably. So yeah, Charles, please tell us a little bit about yourself and your background in chiropractic and what you'd like to share.
Well, it's a little difficult because I have an odd way of getting into chiropractic college. I had no idea what chiropractic was. I was actually seeing a therapist because I was trying to figure out what I wanted to do, and I couldn't figure out what I wanted to do. And she had me take a test, and a group of tests came back saying that I they recommended that possibly biochemistry, being a college professor or even a physicist. And you had to understand, prior to that, I thought I couldn't even make it into undergraduate school. So I thought this was an odd sort of test kind of thing, but I liked the sound of it. But I said I couldn't, there's no way I could teach because I had a learning disability and I couldn't write. I just couldn't have a thought in my mind and convert it um, into written words. I would get lost. I was afraid to get up in front of people to speak. So I knew being a college professor wouldn't be possible. And my roommate, that when I was in undergraduate college, was a biochemistry major, and I just didn't think I wanted to do that. And a physician seemed really interesting, but I wasn't into drugs and surgery, and I really wanted to think of alternative preventative things. It just seemed like a better idea. And I told that to the therapist. I said, I don't know. I don't feel like I know where to go, what to do. And she said, what about chiropractic? And I grew up in Philadelphia. In Philadelphia, podiatrists were called chiropodists.
Prophetess, yep.
And so I thought chiropodists and chiropractors were the same. I said, I don't know if I want to work with people's feet all day. And she said, what are you talking about? Well, isn't that what a chiropractor does? I said, no, they're like holistic medical doctors. So I said, oh, well, that would be cool. I'm interested in that. And so, she had all kinds of connections, and she called, forget his name, but he was president of Pasadena Chiropractic College,
Okay.
and she called him and said, I have somebody here who's interested in going to chiropractic college. Would you speak with him? This is all happening within like 5 minutes. And he said, fine. And so then I went to his office, and he talked to me about chiropractic. And I had no idea what he was talking about. He was talking about philosophies and different people, maybe D.D. Palmer. I didn't know what he was. I didn't know what it was. And he talked to me for like 45 minutes. And at the end he said, well, why don't I have you go to the college and check it out? And I'm thinking, okay. So I drove to the college, which was like around 45 minutes from where I was. I met with someone who was in charge of admissions. He took me around the college, and then he told me I could start college in next week. I'm going, whoa. I don't even know what we're dealing with here. And I said, I haven't gotten all my prerequisites. He said, well, the way we work it here is you can't get a license without having all the prerequisites, but you can take the prerequisites simultaneously. There's a Pasadena City College, and we have a relationship with them where you can do it all, at the same time. And I said, that makes no sense whatsoever to me. I need to think about this. And I was like, it was a whirlwind kind of thing. I didn't know what to do. I tried to, this is before we had internet or
Right.
Google or Siri or anyone to ask. So
Right.
I would go to the library and I'd try to look up chiropractic, and I didn't know what it was. No matter what I tried to do, I couldn't figure it out. I remember I lived in Hermosa Beach,
Mhm.
and there was a chiropractor there, And I called him up. I said, I'm thinking of going to chiropractic college. Can I come by and see your office? And he said, certainly. So I went by his office, and he was not a typical chiropractor. He wasn't doing any sort of adjusting of anyone.
Mhm.
I remember he had a young girl come in who had a cast on her leg that he'd put the cast on, and he x-rayed her leg to see if it was okay, and decided that it was okay. He didn't have to recast it. And that's like all I saw. And I'm thinking, I didn't
That's
I
soldier, huh?
That's a little crazy, Charles.
yeah, I mean, so this is my, so
That's your
now,
journey.
Yeah.
yeah, so, but it's like, I feel like I want to be a holistic medical. Seemed like okay, and seemed maybe that was like it. I don't know. So I started looking around the different colleges. There was a college in Glendale that's now LACC, and it
Right.
was called LACC. So it was Pasadena, and then there was Cleveland Chiropractic College in Los Angeles.
That's right.
Cleveland Chiropractic College was about a half hour closer to where I lived than any of the others, so I figured I'll go to Cleveland Chiropractic College.
Wow.
And I remember I was there. I remember my first day in school, and everybody, is talking about chiropractic. Every instructor is saying how essentially the medical field is terrible and chiropractic is great, and everybody should do chiropractic. And I had no idea what chiropractic was.
But you didn't know what you were doing.
I had no idea of anything. And that went on for the first week or so. Then we started doing some anatomy and physiology that I could grasp, and I'd had some good background in that. So I was doing well. And a lot of the students in my class hadn't really had much chiropractic background.
Right.
So it was unusual. And then I think it was in my second semester at chiropractic college, one of my instructors, his name is Rick Morris. I didn't know he was only 20 years old at the time. He was one of my best instructors. He graduated when he was 20 from chiropractic college.
Wow.
And he was, I think, like salutatorian or valedictorian of his class. And he was just had great poise. And he had said that, if anyone had in the class had problems, they could come to him for chiropractic care because he wasn't going to charge students. And, I thought, oh, that's okay. But I didn't know what chiropractic was anyway. So I didn't know what I was getting myself into. So when I started to go to undergraduate school, I went to Penn State when I was 17. And in my first quarter of school, I got sick. I guess it was a type of mononucleus. I don't know what it was, but it's the most sick I'd ever been in the world.
Legionnaire's disease, probably.
No, I don't know. But my
was
mommy
big.
was there to give me chicken soup. 'Cause my mom would always check in on me. But here I'm in a dormitory. My roommate didn't want to be around me because I was sick. And so I wasn't drinking a lot of fluid. I was having nightmares. And finally, at some point, my resident assistant was called and said, this guy's really sick. Take him to the infirmary. So he took me to the infirmary. And
So that sickness carried through when you went to chiropractic school? Were you in the
well, it was still, I was so sick. They said it would be 3 hours before they see me.
Right.
And then he said, this guy's not feeling well, look in his mouth. They looked in my mouth, put me on a gurney. That's the last thing I remember until a day later I woke up. And I would get sick twice a year. It would last 7 to 10 days.
Wow.
And I was incapacitated. Fast forward to chiropractic college, I'm getting sick like I've been for the past 6 years. And I called him and said, look, I'm going to be sick. I have friends in class who give me the notes. I'll be okay for all the exams. It's only going to last a week. I'll be back at that point. And they said, that's fine. But if you miss more than 3 days, you'll have to start the semester over again.
Oh.
And I went, I don't want to start the semester over again. So I went into school with like 102 fever, 103 fever. And that's when I had that instructor who again said, if anybody needs any care, because apparently the week before he turned 21 and now he could legally practice in California. So I went up to him after class and I said, look, I don't feel well. Do you think chiropractic could do anything to help me with my headache and joint pain? He said, well, come to me. We'll see what we can do. So I went to him. And he must have spent like 2 or 3 hours examining me. I was like the only patient he had. He gave me a treatment, and I didn't even know what it was, except he did some diversified adjusting to my back.
Right.
And loudest sounds I've ever heard in my life in my neck when he adjusted my neck. And I walked out of the office, and I felt Yeah, I think I had like a 99-degree fever. My fever dropped like 2 or 3 degrees.
Wow.
I didn't feel great, but compared to how I felt like, oh my God, this actually did something. And I went back the following day and I walked out without any fever or sickness, and I was okay. And this odd thing about the story is it wasn't until maybe around 15 years ago I realized after I had that treatment, I never got sick like that ever again.
Wow.
And it wasn't like he did anything exotic or anything unusual. He just did
He
it.
adjusted you, cleared out your nervous system. That was pretty exotic back then. Are you kidding?
Yeah, and it was like I went, wow, this chiropractic really does something.
It does.
And
That's amazing.
And now think of all the ability you have now to write. How many hundreds and hundreds of articles have you written too, as you've been able to make that connection to your brain?
I think that was the therapist. I was still seeing the therapist at the time, and when I graduated, she said, "Okay, now I want you to write a paper for publication." And her name was Ruth. I said, "Ruth, I can't write. You know I can't write. That's why I went to chiropractic college." And she said, "Find something you're passionate in. Take your time. I don't care if it takes you 5 or 10 years. I want you to write something for publication." And so I started working on it, and I worked and worked and worked. And 3.5 years later, with a little help, I got my first paper published.
That's awesome.
That's incredible.
So look, that's a great background story, and I think that's so many people have gotten into chiropractic, knowing little about it, but getting kind of results that you got, like, and even thinking back, like, oh, I've always been sick. Every winter I get sick. Started seeing a chiropractor. I don't get. I mean, we hear this all the time. I mean, that's a big part of pediatric practices too. That people bring their kids in because they get chronic illnesses over and over again. They've been on antibiotics, 2, 3 years in a row, and so that's a real. It's powerful that. And like you said, you didn't do anything, air quotes, special, except adjust your spine and clear out your system. So that's awesome. So I have a question for you.
Yeah.
So for other individuals who are aspiring to excel as chiropractors, based on your journey and your experiences, what kind of advice would you give them if they want to basically build a practice, have a long-term, reign in this field? What would you say to them?
It's a fabulous question. And it's twofold. The first fold is find out how to handle your student debt ahead of time. So keep your debt as low as possible. See if there's some way that you can manipulate things so you're going to get into some form of a forgiveness program so that you can maybe work in a nonprofit and get your loan forgiven, because that's going to be a crucial thing that it's not being discussed enough. The other thing is, and I know it's totally biased, but for me, SOT, Sacro Occipital Technique, is the way of the past, present, and future, as far as I'm concerned, because in the future, I started looking at all the doctors who I know who did SOT. In their 80s, they were still practicing. I last saw Dr. DeJeanette treat a patient at 86 years old, and he had no problem doing whatever, but it was because he wasn't doing all kinds of side posture stuff. He wasn't he's using his body in the optimal way because the wedges and blocks and methodology opened those doors.
So Charles, could you tell us a little bit about how you got into SOT?
It's also kind of funny. I graduated chiropractic college, and there was I think a 5 month hiatus between when we could take our state board exams. So I thought one of the best ways of learning something would be to teach it. So I thought I would teach something that was exotic, and I didn't know anything about SOT except I had taken an elective, but made no sense whatsoever to me. But it seemed complicated, and it seemed like the doctors who taught it really had a good basis in anatomy, physiology, endocrinology. They understand cranial stuff, all these things that were not even discussed even slightly in chiropractic college, from my perspective, at least how to clinically apply them. And so I had Dr. Denton was one of my instructors, and Dr. Chris Budding was the other one. And I'm trying to figure things out, and I don't know. And one of the students in my class, actually, I had a couple situations. One was Dr. Denton was doing an experiment and trying to show us how the categories worked. And he called up someone for a sample person, and I volunteered. And he was trying to muscle test me and do different things. And I just didn't believe in muscle testing. And I just fought everything he did. And so he then decided that I was a category 1 patient, which related to sacroiliac joint imbalance sensation. So I started so he had me turn over, he treated me, and I thought, this is nonsense. How could blocks that don't make any sounds, do anything? And I just didn't buy into it. I went home that night, and while I was studying, I felt I couldn't turn my head to the right. I turned my head to the left, but I couldn't turn to the right, and it was like locked and fixated. I don't remember anything happening. And I went to class the next day, and I had to be careful driving because I was really fixated. And one of my friends had been to an SOT seminar, and he saw me come in, and he said, "What's wrong with you?" I said, I can't turn my neck. He said, "Oh, I bet you were a category 2, and he treated you as a category 1. I said, "Yeah, I'm sure that's what it is. I'm sure those wedges did all that stuff." No, not really. So he said, "Lay down on the table." So I laid down on the table supine. He did certain tests, treated me as a category 2, had me get up and walk around, and all my neck pain and limitations went away within, less than a minute.
Yeah.
He went, wow.
That's incredible that story is. I have the same experience with SOT. I'm going to keep mine really short, but I was an upper cervical guy. Somebody sitting next to me took an SOT seminar and decided to block me a category 1 after being a hockey goalie for 15 years prior. And I went to go to work that day, and I get to work, and a half hour into work, I can't walk. I'm dragging my leg, and I was literally crippled. And then I came home. She's like, "I don't know what to do." So we found the guy who taught her the seminar, did the same thing. Go, "He's category 2." Blocked me category 2. And I went, wow, if this could mess you up that bad, this stuff can really help you.
Yeah. I mean, it's pretty wild.
It's wild.
So that classmate told me that DeJeanette comes into town 4 times a year. He goes to 4 different doctor's offices, Monday, Tuesday, Wednesday, Thursday. And, if I'm really interested, I may want to check it out. So I remember going to one of the doctor's offices. I was waiting in the waiting room. I was so shy.
Right.
I just stood there, and finally the secretary, after like 30 or 40 minutes, came by. "Are you here to see somebody?" I said, "Yeah, I wanted to watch Dr. DeJeanette treat patients." He said, "Well, come into the room. You're not going to see him out here in the waiting room." So I said, "I didn't know if I could." She said, "Well, yeah, come on." So I went into the room, and there were like 4 or 5 doctors there, and he was finishing up with one of the patients. And then the doctors left, and I was just standing there in the corner while they were bringing another patient in. And he said, "Oh, how are you?" I said, "I'm fine." He says, "What's your name?" I said, Charles Blum." He says, "Oh, are you a chiropractor? Are you a student?" I said, I'm a graduating student. I'm going to be a chiropractor soon." He said, "Oh, that's great." And he said, "Hey, I'll tell you what, sit down next to me and take notes. That'll save me time. And that way I don't have to write any notes down." I said, "Okay." I'm thinking, my God, Jeanette is telling me. I sit down next to him, patients come in, and he starts telling me what to write down. And I wrote down whatever he tells me. And that went on for the rest of the day. And then,
wow.
And then it got to the point where every time he'd come into California, twice a week, on a Tuesday or Thursday or Monday or Wednesday, whichever it was, I'd pick him up at whatever house he stayed at, drive him to the office,
Nice.
with him for lunch, then take him after work back to a different house. And I just got to be with him. And the people say, "Oh gosh, you must have had so much to talk to him." But I was so shy.
Right.
I was afraid to ask him anything. So I was letting him initiate, and he never initiated. And it wasn't until, I don't know, maybe like a year or 2 after he stopped coming to California, one of my friends, Rod Shelley, whose office he went to all the time, said, "DeJeanette had always said that Blum was really unusual. He never says a word. He never asks me any questions." I'm thinking, but I got to watch him. I got to see how he was.
That's amazing. That's incredible.
I got to listen to how he would talk to people, and it was an amazing gift. Amazing.
That is incredible.
And so, I mean,
yeah.
Here I am treating patients. You have it too. How many patients come to you? Where's a doctor near you? Near me where I live. Where's this? And they can't find anybody.
Right.
It's if we can get a doctor in an area, there's like more than enough patients. And these patients are self-directed, they're the ones who want to, they'll do anything to get to see somebody. And once they see, a chiropractor, an SOT chiropractor, they want to know who else can they
Right.
they say, can I refer my cousin, can I refer my brother, can I refer, and it's I don't hear that from other techniques in the same way.
No.
So I mean,
I think you're right. I think that SOT has two, I guess, for the better term, advantages. One is that I'm never afraid to treat anybody. Like, it doesn't matter what they have, how old they are, how young they are, because SOT has a paradigm where I can do anything from the lowest force work to, if I wanted to do high velocity adjustments, access the cranium, access the dura. You know, if you hit a plateau, you've got cranial work, you got CMRT. Yeah, like you don't ever really hit that plateau with your patients because there's always deeper levels to look at. And you're right. And so when people start coming to people who do SOT, and also my experience, my personal experience is that because there is a high learning curve with it, the people who do SOT are dedicated. Like you said, I know people who are practicing. I'm in my 70s. Oh, well, I'm not quite in my 70s, but I will be there. I'm very close, as my wife. But I know people in their 70s. I know people in their 80s who are still practicing. You're right. I saw Dijon at practice when he died in 92, right? So he was just 92 years old. I saw 91. I saw him practice. I saw him adjust people at 89. Like, I saw him do that. Yeah, and if this is something that you love and have a passion for, that SOT allows you to do it literally till the day you die, if you choose to.
no, I had a patient of mine, a chiropractor from Australia, come. She was 54 and had to retire. And I said, why? She was treating rugby players and doing side posture adjustments.
Right.
I did orthopedic blocking and category blocking. And she said, oh my God, had I have done this, I could still be practicing.
Absolutely.
20, 30 years. So.
True.
You know, there's people who are really aware of their body too. Notice, I remember a friend of mine worked for the Boston Ballet, who was a chiropractor, and he did a lot of diversified stuff. And a lot of times you get people, because they're hypermobile, that, you know, just were plateauing. And I'd come to my office and I would just check them out. And, you know, most of them category 2s, hypermobile, strained SI joints, block them and get up off the table, and they would just extend. They go, wow, what was that? Because there's, you know, so you're right. So it's awesome. And it does the same thing, you know, in the pediatric practice, because Dijonette's anatomy and physiology and the things that he discovered, we're seeing now with the tools that we have, which he didn't even have, we're seeing that he's right. He talked about the dural system, and we know how important the dural system is in this subluxation pattern. So yeah, I think that's amazing. So for you, on a personal note, after all your years of experience and your teaching it, what aspects of the work in your field do you find most fulfilling and rewarding at this point in time? Or even might have kept you going, let's say? You know, what is it about the chiropractic?
You know, I'll never forget my first experience in chiropractic college. I was in the clinic, just entered the clinic. I was only allowed to treat students. And this student came by while I was in the hallway and said, I've got a terrible headache and I have an exam in the next class and I can't concentrate with a headache. Would you treat me? And I thought, well, I guess. I mean, so we went into one of the rooms. I treated her, and she got off the table, and she gave me a hug. Said, oh my God, I feel so much better. And she even came back an hour later and thanked me. Came to my classroom, and it was the most unbelievable high experience I'd ever had in my life. I'd never felt so good in my life. That thought helping somebody, making them feel better, having an impact. Yeah. And I remember that people would tell me, you know, when I was in the clinic, I said, gosh, it's so amazing. This is wonderful. I said, yeah, that's the way it is when you start out. In my first year of practice, I was telling everybody, yeah, it's the honeymoon period. Right. And then the first 5 years, they told me, yeah, the first 5 years, sometimes you're the first 10 years. And I'm figuring by I hit 10 years, I realized I must be doing something right, because it feels so wonderful to be able to help somebody in need and be there for them. And it's, I mean, it keeps on going. You know, in 40 years of practice, I saw some patients today, and what a wonderful feeling being able to help people and make them feel better.
Yeah, wonderful. That's wonderful.
You know, it's true. You know, I know I've over the years, we've shared patients, you know, people who moved to the West Coast, and the patients, and you've seen patients of mine who I've seen since they were little babies, and they're, you know, in their 30s and 40s now. And they always say that about you. And they come back and say, Charles goes, it's so much fun in his office. He's just always so happy. He's just always so there. And then, of course, they're always looking at me going, you're always like running in and out of the room. I'm like, I'm like, yeah, I don't quite have that same personality as Charles has,
Yeah.
but
Well,
but they
we're all
still,
different.
right? Yeah, but
I
they
mean,
still love the chiropractic. That's that's the driving force for them. Just like you said, it's they know they're getting help, they know they're getting cared for, you know?
Yeah, and so,
but that's one of the wonderful things about SOT, and particularly you, because you're an inspiration for me, that you could see patients in a short period of time using SOT and
Right.
have huge accomplishments, whereas me, I move slower. It's just,
Right.
and so I spend more time. But SOT has a place for either type of ways you want to practice. You want to
That's
spend longer, you want to spend shorter, and it's not all techniques have that availability.
I know
so,
that's
so
one of the things.
I want,
Yeah.
I want to ask you, Charles, I know that so your love of practicing is inspiring, but we know also that you've taught SOT for many, many years. Can you share a little bit about that experience and what drives you to continue that? Because we know many of the students that have studied with you, we know how accomplished they are and
That's true.
they're doing amazing work. Some of them have come to continue studying with us. So how does that fit into your life, and when did that start for you?
It started before I started with SOT, because when I was out of school, I started to teach SOT before I even knew what SOT was.
Well,
I had to go through all of Dr. DeJeanette's books, and I would go through them like 6 or 7 times and then rewrite them so that I could teach it in a way that made sense. And that was the way I kind of learned it. And then I started teaching students, and it felt wonderful to be able to teach. And then at some point I realized I really needed to get certified. So I've, been with Dr. DeJeanette, and he usually said you had to wait 2 years practicing SOT before you could start
Right.
teaching.
That's right.
But he let me start right away and
Awesome.
started teaching with him. And it was terrifying and scary, and I would forget what I want to say. And the only way I could handle it was I'd over prepare. So for an hour of teaching, I'd spend 15 to 20 hours, and I'm not exaggerating.
I believe you.
When I would teach in Omaha, I
Uh-huh.
would sometimes spend hundreds of hours for
Right.
1 hour of lecture. It was totally ridiculous, but it helped me feel my nerves wouldn't be quite as nervous.
But people forget we didn't have PowerPoints,
We
right?
did not have
We had
PowerPoints.
either mimeograph sheets that we made on those overhead projectors,
Yes,
or we
you
had,
were lucky.
or if we're lucky, or we had index cards. So it
Yeah.
wasn't like you could press a button. Oh, that's what I'm supposed to teach. There's the next slide.
Oh,
I want
totally.
to say, but I want to say one thing. For all of you who have taken taken our work and done pediatrics, this is the man. This is the man who got me started in teaching pediatrics. This is the man in 1999 or 98. He was on the board of SORCI, and he came up to me and he said, DeJeanette talks about pediatrics, and we have some people doing it, but we don't have a pediatric program. Will you teach a pediatric program to the SORCI doctors? And I wrote my first pediatric program then, wrote my first pediatric manual. It was a 12-hour seminar for SOT, and this is the man who got me to do that. And he's right. 100 hours I spent on that 12-hour seminar talking to all, and I knew I was talking to people who are either my peers or people I emulated. And yeah, it was a lot of long nights. And but so anybody whoever wants to know how I got started or where this stuff came from, send your accolades to Dr. Charles Blum, because probably without him, I probably wouldn't be doing this at this point in time.
You definitely nudged him, which is awesome.
Well, he was, ready to happen. He was on the edge. I remember at that point I was going around, and there were just doctors who had very tremendous knowledge and teaching skills. And you were one of them. I remember walking by a region where you were doing table instruction. I said, oh my God, this guy knows this stuff backwards and forwards. Why isn't he up on the podium teaching? This is where he should be. And that's when I asked you, and I'd heard you said that you liked pediatrics.
Right.
SOT had no clear pediatric program, let alone a cranial pediatric program.
Right.
And so you just took it on in a way that was like amazing, and it was beyond whatever ever I would have hoped or dreamed of.
Wow, that's awesome.
Well, thank you, Charles, for pushing him to do that.
So do you have, since we're talking about SOT and it's about, do you have, and I know this is a really tough question, it's kind of a weird one a little bit, but can you probably share, because a lot of our audience is SOT doctors, some of your favorite techniques or something you found really effective when dealing specifically with the pediatric population, like maybe the way you look at things, anything that like sticks out for you around that, if there is, please share.
Well, What I tried to start to do is realize that we're dealing with different types of entities when we're dealing with newborns, dealing with young children, and
Right.
dealing with the adolescents. So it changes, and a lot of this is stuff you brought out when you started writing the pediatric manuals, because we never really discussed it clearly prior to that.
Right.
You know, when we're dealing with membrane and stuff like that, it's not like we're dealing with bones that are out of position as much.
Right.
And so I developed a format of dealing with children where I just go from the pelvis, diaphragm, and suboccipital area, cervical spine, and then cranium, and I just have a specific fascial unwinding protocol,
Nice.
and I'll send it to you. I'll send it to you, and you're welcome.
You can actually teach it to our people online
Yes.
one of these days.
I could even do that. It's an easy thing to do. It's a good,
I
quick
love that.
protocol for young children.
Absolutely.
That'd be wonderful,
because-
Charles.
Oh, wow. Okay. Whatever you want to do with that, I'm happy.
Yeah, I mean, you can share it. I mean, you can send it to us and we can
I'll send it to you so you can see it.
see it, but definitely want you to, yeah, we'd love
Yeah,
to
I
have you
would
do.
love
That's
that.
awesome. That's awesome.
Thank you, Charles.
So I think you've shared enough memorable experience, and the fact that you got to do that and watch Dishan at work. I mean, I've seen him work a couple of times, but at seminars, never in that close proximity. I can't imagine that effect would have had on how you practice. And you know, he was an amazing healer and intuitive healer. So that's really incredible. So before we sign off, or is there anything else you'd like to share? I mean, no, I do. I want to share something, because you didn't say anything about your research, and we want people to put that research out. Like I said, you've done at least 6, 7, 8 papers with me. So please, before we end this, talk a little about, number one, your research, and also how people can get in contact with you to learn more SOT, because we don't teach a lot of adult SOT at this point, and get some research published. So please do that before we sign off.
The SOT research, you're always welcome to email me at drcblum@aol.com. D like David, R like Robert, C like Charles, B like beautiful, L like lovely, U like unforgettable, and M like manly at AOL.com. You have to say that.
You've done this before.
but I'm happy to help anybody. And with regards to learning SOT, I recommend going to the SOTA USA website, check out the directory, because it's really important that we do SOT the way Dr. Dejeanette developed it, to do CMRT the way Dr. Dejeanette developed it, and do the cranial stuff as much as possible the way he developed it. Because if we're saying we're doing SOT, we need to make sure all of us are doing the same thing, or SOT will have 20 different meanings and the research won't have any effect.
Absolutely.
So, I mean, research is important because it's a very political thing. If we don't do the research, there won't be a future for our technique. It already is under extreme challenges with much of our academic and research community wanting to eliminate technique systems.
Right.
And the only thing keeping SOT going at this point is that we have at least some research.
Right.
Currently writing the CMRT text, and one of the big things was there wasn't any research on CMRT.
Right.
And many people were doing it different ways. So one of the things we're trying to do is have a standardized form of what CMRT is, and then get research to support it. And luckily, I now have 20 or 30 or 40 articles that we've written that support CMRT. 20 years ago, we had like 2 or 3. So now that we can now support, hey, we're doing something, there's research to support it. And that's it's just a big issue, because if we don't do that, like I had, like in Massachusetts where you're living, there was a situation where they were eliminating CMRT from being able to be taught in postgraduate education, because there's no research to support it. I wrote letters, I sent stuff to them, and we got it reinstated. It was the research that allowed it to happen.
That's great. Well, thank you, Charles, for that.
Yeah, that's awesome. And for those of you who want to do research, don't be shy away from it. With Charles's help, it really is so much easier. He does a lot of the heavy lifting, and he'll walk you through the process. So if you have a few spare moments and you have a case that you think is interesting, write up the case. Simply write up what the symptoms are, what you found, what you adjusted, and just maybe get that off to him and let him take a look at it. And if it's worthwhile, he'll help you do it. I hope I'm not throwing too much at you, Charles, but I know people. But I know you. Yeah. I know.
We offer it to everybody, and I'm not inundated yet. So once I get inundated, I'm happy to offer it as many.
Right. But I'm just saying, yeah. So Charles,
Yeah,
this
thank
was
you so
awesome.
much,
Thank you
Charles.
so much for coming on with us. We really appreciate
Yep.
it. We appreciate everything you do for the profession. We appreciate your brilliance, your compassion, and I don't know what else to say. But we'll be talking to you again soon. I can't wait to see your pediatric protocol. I think it'll be awesome, and definitely we'll find some time for you to either do it like on a Facebook Live, or maybe even if you want to come to one of our seminars one time,
I would
It'll be
love
awesome.
that.
Yeah.
All right.
All right, thanks,
All
Charles.
right, Charles. Have a great
Thanks
night.
a lot. Take care.
Bye.
Bye bye.